Guidelines for frictioning the cervical spine. Of course, learning any hands-on techniques takes personal instruction. These techniques are demonstrated here for your information, but generally cannot be mastered unless there is private instruction in addition to this DVD. Use no lubricants. Friction therapy is done dry with no oils or lubricants. Keep your friction strokes perpendicular to the fibers of the injured tissue. For example, to work on the supraspinous ligament between C4 and C5, you would move horizontally at a right angle to the spine. Whenever possible, perform friction at a full 90-degree angle to the tissues. For certain structures, such as the 7th intertransverse ligament in the neck and the iliolumbar ligament in the low back, the best you can do is a 70 or 80-degree angle. This is also effective. Apply pressure in one direction only. A complete friction stroke is composed of a movement done with pressure in one direction and a return movement done without pressure. Alternate the direction of pressure as often as needed for your own comfort. Work on one side at a time. I've had several students who got so excited about learning this material that they sometimes worked on both sides of the neck simultaneously. This treatment can be a little uncomfortable, so I recommend that only one side be treated at a time. Use varied finger positions. Use your fingertips, thumbs, reinforced fingertips, and reinforced thumbs. Keep your fingernails very short. Otherwise, as you try to use your fingertips, you'll end up scratching your clients. Besides making an unhappy client, scratching the skin also causes a scab to develop, which will hinder further work in the area until the scab heals. It may take some work to get your fingernails short enough to perform friction therapy. Alternate hands often. Alternate hands at least every few minutes while frictioning so that you don't tire or injure yourself. There are often multiple injuries in the neck requiring very focused treatment for 15 to 30 minutes at a time. Move your whole hand. Whenever possible, move your whole hand, not just your fingers. Some movements require you to use only your fingers, but it's best not to do those movements for very long. Make sure the skin moves with you. The client's skin should move with your fingers as you friction. Don't slide over the skin. If you do, you'll irritate the skin and cause an abrasion and bleeding. A scab will form, making it impossible to work on the person for a week or so. When practitioners begin doing frictioning, they often forget this important principle and lose a client or two along the way. To get a better understanding of the distinction between moving the skin and moving over it, try each of these on yourself. First, place your finger on your cheek and move the skin up and down. This is what you should be doing when you friction. Now rub your finger over the skin for a moment or so and feel how that feels different. Then place your thumb tip over one of the tendons at the anterior portion of your wrist and practice taking the skin with you as you friction. Press the structure against the bone. When performing friction therapy, you'll be pressing the ligament, tendon, or muscle against a bone. Be sure the client is comfortable. Be sure that the client is in a comfortable position so that you can perform friction therapy without causing unnecessary stress. For example, if it's painful for the client to lie flat on the table, you might place a small towel under the person's head. I've also had clients who could not lie supine without extreme pain. In these cases, I've had the person remain in a prone position while I work on the neck. Friction treatment protocol. Now, let's discuss the protocol for friction treatment. We'll address issues of frequency, duration, and pacing, as well as what to do after you've frictioned. Frequency. When clients are receiving friction therapy in the cervical region, it's best if they come 2 or 3 times per week. Consistent treatment aids the healing process. As recovery proceeds, you can lessen the frequency of your sessions. Duration. With this treatment, a recent injury takes about 4 to 6 weeks to heal, and a long-standing injury takes about 8 to 12 weeks. These are generalizations, of course. The actual healing time will vary depending on several factors. 1. How long the injury has been present. 2. Whether the person is repeatedly re-injuring the neck, for example by engaging in stressful athletic activities or performing damaging repetitive motions at work. And 3. The client's general health. Usually, the better a person's general health, the faster he or she will recover. Ideally, you'd begin the treatment 48 to 72 hours after the traumatic injury. At this stage, not much scar tissue has formed, so very little frictioning is needed. 30 seconds to 1 minute of gentle frictioning at each site should be adequate. However, generally you won't see clients who are that recently injured. In most cases, there are multiple neck injuries, so you'll be doing friction for 5 to 10 minutes at first, and eventually increasing to 20 or even 30 minutes in each session. The precise duration of each treatment depends on the severity of the injury and the number of areas in the neck that are injured, as well as on the client's tolerance and the sensitivity they have in their tissues. Pacing. Typically, 5 to 15 neck ligaments are injured simultaneously. After you've frictioned a ligament for a few minutes, move on to the next one. The neck is often too sensitive to tolerate too much work on one segment. As you progress, slowly work more deeply. As I've mentioned before, it's important to avoid over-treating with friction therapy, particularly when you're working in the cervical region. Some clients can tolerate only very light pressure at first, and you may have to work for a long time using barely any force. Educate your clients so they can help to guide your work. Before you begin, explain that the process of breaking up scar tissue is somewhat uncomfortable, but should not cause acute pain. Check in frequently with the client to be sure you're using the optimal amount of pressure, especially if you suspect that the person may be reluctant to tell you to lighten up. If the client feels more than a slight discomfort or a mildly annoying sensation, you need to proceed more gently. While you're working, also be alert for any nonverbal cues of discomfort. Observe your client's face and breathing during the frictioning. If the client says everything is fine, but constantly winces or moves away throughout the treatment, decrease your pressure. Also be aware of your own level of comfort. Because this work is so precise and repetitive, you may find yourself getting tired and sore at first. Build up your hands by frictioning for very short periods of time at first, and by exercising with clay or a squeeze ball. Post-friction guidelines. After you've completed a session of friction therapy, fully massage the cervical area, both supine and prone. This helps to enhance the circulation in the cervical region. At the end of the appointment, remember to mention that the area you treated may be sore for up to 48 hours. If the client tolerates ice well, using ice on the area will often mitigate the soreness. Check in at the next appointment to find out how the client felt after the treatment. If soreness lasted for more than 2 days, or if the client simply can't tolerate the soreness, cut back on the pressure and duration of the friction part of your treatment.